Good evening to all, and a very warm welcome on this occasion of launch of the e-launch of the Manual of X-ray book, Volume 1 and Volume 2, and which is authored by Professor Rajendra Prasad. And I would like to also express my gratitude to the MediSage for organizing this online webinar on this interactive discussion on chest radiology under the aegis of National Academy of Medical Sciences, India State Chapter Uttar Pradesh in association with Indian Chest Society UP Chapter. I would like to welcome our guest of honor, Professor D. Behra, Padam Shri, Director Pulmonology, Fortis, who is presently Director Pulmonology, Fortis, Mohali, and who has also written the foreword of this book. I would like to welcome our person and the chief author, Professor Rajendra Prasad, Dr. B.C. Rai Award and awardee and ex-HOD Department of Pulmonary Medicine, KGMU. Then I would like to welcome Professor Surkan sir. Probably he has not joined till now. Presently working as Professor and Head Department of KGMU. Kumar Singh sir, who is a Senior Consultant Pulmonologist in Regency Hospital, Kanpur. I would like to welcome Dr. Kiran Vishnu, who is also a co-author, Associate Professor, Government Medical College, Trivandrum. So before starting, I would just like to say two lines about this book. That so this is basically an X-ray book, and it contains actually the all the X-rays and images. As far as I know, is all the images and X-rays are of the actually real life patients of the last 40 years of the practice of Professor Rajendra Prasad. So with these words, I would now like to invite Professor Rajendra Prasad for his presentation.
Thank you, Dr. Nikhil. And my good friend, Dr. Behra, Dr. A.K. Singh, I think Surkan has joined. Two of my co-authors, I must say, Kiran Vishnu, who is a associate professor in Trivandrum. He did MD under me quite long back, around 2007-8, when we did do the NAPCON. He was the main architect from resident side at that time. Nikhil is another author who is again associate professor in RML Institute, Medical Sciences and Research, Lucknow. And A.K. Singh has also, luckily I have been very lucky, except Professor Behra, probably I have taught everyone, including Professor Sur, and you know Surkant is currently is a very star person and heading the Department of Respiratory Medicine in KGMC itself, where I have headed for a very long time. You know, I taught to MBBS students in KGMC. In KGMC, let me go to the little history. I think A.K. Singh and Kiran Vishnu and Surkant, who has been my student, luckily they know it, that in our KGMC, we have a MCI plus. At that time, MCI plus, we used to have a short clinic in Department of TB and chest disease. Then it was converted into pulmonary medicine. And only senior teacher used to teach final year students of small batches. Short clinic consisted of, we have about 185 students. It consists of about 25 students each batch. And they used to visit those departments where exposure to the MBBS students were less. We were lucky that TB chest department was also one of them. So our short clinics have been very popular. Initially, it was started by Professor B.K. Khanna Sahab, my mentor. And then it was started mainly by Professor P.K. Mukherjee, again my mentor. And then ultimately, when I became head, it was taken over by me for about long years, 11 years. So what I'm trying to say that education has been, I think, is a very fruitful, because some of the feedbacks I might tell you that those students at that time, I'm talking of 80s, 90s and 2000, they have become now professors, directors and whatnot. A.K. Singh and Kiran Vishnu is one of them, and Surikant including. And then what they some of them become Facebook friends. And when they wrote in my Facebook, "Sir, why you are not coming with the book what you taught us for so many years? You made chest medicine clear and chest X-ray clear. Whatever you taught in those classes for about 1 hour daily for a month period. Probably we are having that knowledge and we are running our whatever chest things we see, which we have those backgrounds. So based on their demand, I initially thought to write. Writing a book is not easy. This is my 12th book. In my atlas, I have already burned my fingers. That I took 5-6 years to. So I was knowing that a book which has photos is difficult to publish. So anyhow, I have a good record keeping. So I searched based. First, I put on a YouTube for your information that YouTube is very popular. More around 3 lakh people have viewed that how to approach a simple thing like a chest X-ray. And then they again demanded that why not you coming with the book, because those X-rays will vanish with you. So I thought and I worked. Thanks to COVID, during those period online, this book is mainly I have completed online, except in the last visit I went to the publisher in Delhi and said that to see the hard copy, how it looks like. So as Nikhil said very rightly that whatever these X-rays are all Indian, our own patients' X-rays, and explaining. I will just, in the end, I will share, if time will permit, some of the slides which talks about this book. This is in 2 volumes. Volume 1 has module 1 and module 2, and then the volume 2 has module 3 and module 4. In most of the part, in volume 1, it has how to approach, how to read very systematically. And then in volume 2, rest of the thing. And volume 2, another good point I have posted that what are the common radiological findings of common respiratory diseases. That is how this book goes in the 2 volumes. And this is published by the CBS brothers. And I'm lucky to have Professor Bera, who wrote the 4 apart. Otherwise, Dr. Jankaria has also written the foreword, and 2 more people, head radiology of KGMC and head radiology of ERA, they also wrote foreword. And one of the principal foreword writer was Professor Bera, who wrote foreword for this book. So that is what I was wanted to tell. And this book, utility of this book too, I believe, everyone, though we have advanced in radiology like CT, PET, and so many things, but still the chest X-ray, to my mind, everyone has to read. Even today we take classes of chest X-ray in ERA Medical College, and we say everyone has to see the chest X-ray. May it be a simple doctor like MBBS practitioner, may it be a specialist, may it be a super specialist, and not only the allopathic system. My feeling is of the Ayush, every homeopath, Ayurveda, everybody sees the X-ray. And what we have seen that the X-ray interpretation is very poor. What we have seen, misdiagnosis, wrong diagnosis. All things are happening. As a chest physician, we all agree with you that we in day-to-day clinical practice, we find this. There are a lot of quality issues in chest X-ray that we have made a separate chapter, how to. So everything we have compiled, and good news that it has come up now. It has not been yet released. They are going to release first time online. They requested me, that yes, you can go ahead. It will be released possibly in coming NAPCON in Hyderabad in a physical form. So I think with these words, I hand over mic, and if the time will permit during this time, I'll share. It has, as I said, it has 2 volumes, and the authors I just said I'm the main author, and then my help Kiran Vishnu and Nikhil both has helped me. Kiran, I will tell about a line about Kiran, that he did MD under me way back in 7 and 8. He will tell himself, and he was the one whom I mooted about the idea of bringing out a book on chest X-ray. And he wrote one or two initial chapter. Then he became very busy. He did his DM and now as associate pro. He will himself tell. So it is in 2 volumes, and volume 1 has 2 modules. Module 1 means how to read normal chest X-ray, and then very systemic way of seeing soft tissues, bony case, the way I taught to the MBBS and PG students. Then diaphragm. Then in module 2 we have say about trachea, heart, hilum, mediastinum, and then lung parenchyma. In lung parenchyma, we have many segments, how it is divided, then what are other types of shadows like radiopaque, infiltrative, cavity. And then volume 2 has 2 modules again. Module 3 has the rest of the lung parenchyma like miliary lesions, nodular lesions, mass lesion, calcified lesion, pleural lesions, all have been described in detail. It is around 1200 pages book, both volumes. And then module 4, I was telling in the volume 2, has radiology of most common diseases in the chest medicine. Radiology of tuberculosis, radiology of bronchiectasis, chronic obstructive pulmonary disease, allergic bronchopulmonary. I had a lot of fun with ABPA. And then radiology of lung cancer, then radiology of ILD, then sarcoidosis, and even we have had a chapter on COVID. And beauty of this book, actually my idea came little bit from Felsen, because when I was a junior resident way back in 76, our seniors used to tell us there's a small book of Felsen at that time in our library. You read it within, and we read that book in 3-4 hours. And the beauty of that Felsen's radiology, chest radiology, was only the photos were there, matter was less. So same principle I applied in this. Because whenever you read a first book, you get an idea. So here written material is less, and most 90% pages are the photograph or the X-ray. The last in this book, one I have made radiology quiz, in which I have made quiz and shown the X-ray, asked the question, and answer is also given and some page. And then I ask the readers to evaluate himself how much score you got out. I think there are 26 such quizzes, and which I have given the method of scoring, and I said that if you are good, then it means you have understood. If you are not in a good score, then you can read again book. That is how the book contained, and I think these are the authors which I have already shown you. And next to me, this is a very useful book for most of the doctors. Thank you very much. I hand over mic to for the rest of the proceeding.
So this is our agenda for today's program. So I think we'll have a panel discussion now. Dr. Behra, sir, is a renowned specialist in respiratory medicine, awarded with prestigious Padma Shri Award with a huge clinical experience of over 40 years. Welcome, Dr. Behra, sir. And we would like to have you giving your inputs for today's session.
Thank you very much. Very good afternoon, Professor Rajendra Prasad, Suryakanth, Dr. Singh, and other friends. It is really a matter of great for me that I am now taking part in this launch of this e-book on chest X-ray that has been authored mainly by Professor Rajendra Prasad and also two of our young colleagues. You see, as Professor Rajendra Prasad, and as I know of Professor Rajendra Prasad, he is a veteran in the field of respiratory medicine in this country. I always tell my other colleagues he is a Bhishma Pitama of pulmonary medicine or respiratory medicine in this country. He is the teacher of teachers. In fact, as we say, it is not only the father, it is the grandfather. He is the, I do not know what will be the correct term. It is the, if we call it the grand teacher of teacher, that means the generation of teachers. He has been teaching. He's an outstanding, teacher, a clinician, and a human being with vast knowledge about the subject of chest medicine. And we always, respect and uh, keep him in high esteem in this country by everybody, irrespective of whatever age he or she belongs to. And it is very nice that he has shared this, I should say, this ratan, because for every chest physician specifically, those who deal with the chest x-ray, it is not only chest physician, it will be many physicians. Chest x-ray is one of the very, very basic investigations for everybody, every clinician, even if you are not a surgeon, before going for a surgery, before for fitness, then you have to have a chest X-ray. Otherwise, I don't think medicine, which does not obviously it is the I should say the bread of butter in that sense of the chest physician. It starts with a chest X-ray, and Beji, as very rightly he has said that although the in the with newer and newer techniques, technologies, they have come up with the radiology of respiratory system and specifically chest. But I think the basic is the chest X-ray. He has also included the CT scans in his in his book. The second aspect I should say is the I which I appreciated most is the including to youngsters. As the authors in his book, he could have done it himself, taking the entire credit. Although I know he's the main architect, but by incorporating two of the young authors, the views of the younger generation and their ideas about chest X-ray, how they look at it, and that has been incorporated. And that is a great thing about Dr. Prasad, just giving opportunity to the youngsters. As I said, he could have done it himself. He could have just put his own name as the only author, but that is another greatness of Dr. Rajendra Prasad. And ladies and gentlemen, I think one thing he told, which I thought I must comment on that, he told that he had taught everybody, whereas sir, that is not correct. Although, you have technically, you have not awarded me the PG degree or MD degree or that MBBS degree, but obviously you are a great teacher, and we always, in that sense, you are a teacher of mine. I always regard you in that sense. So, with these few words, I again, I am sure this book will be very, very useful. I have gone through the contents as he has said. I have written the foreword. I have gone through the chapters, the X-rays, the and how they are interpreted. The basic thing as a clinician, as you see the chest X-ray, I always believe the interpretation of a radiologist. Obviously, they are not different. Maybe they are better readers than the chest X-ray. We always look into the reports of the radiologist, but I think as clinicians, we need to be very well trained about the chest X-ray interpretation. We should be competent, in fact, in that. We should not only depend on the radiologist's report. Many times it is also not possible to get a radiologist report. In a busy hospital, when you are having thousands of patients you are seeing, I don't think many of us may not even get the chance to get a report from the radiologist because they cannot handle that burden. I remember, and I still it is practiced in PGI where I was taught and where I was working for more than 40 years. So obviously they cannot report because they don't have got that manpower. I mean to say, although we learn from them how to interpret, how to do that. We used to have radiology classes, but what I'm trying to see for a particular X-ray of a patient, they don't have got enough manpower. Neither there is a time that they and treat the patient. And in the context of currently as the many diseases, the scope of respiratory diseases has come up, the viral infections, the interstitial lung diseases of different spectrum of diseases that I need not tell you people. So I think everyone who is handling the chest case should be very thorough and should be comfortable enough, competent enough to interpret the chest X-ray, even if we don't get a written report from the radiologist, which many times is not possible. So I'm sure I again congratulate and thank Professor Rajendra Prasad sir for gifting us this beautiful book, and it is for everybody, as he was told, starting from MBBS students to the super specialist, even the teachers, the practitioners, and from others who again they will be all beneficial, and as will all be benefited from that. And whatever he has actually, usually the great thing about great teachers is to share. You just don't keep it to yourself. So he had found time and the wish. It is always also your wish is also very important. How much you want to share. Many people they don't want to share things, right? वो कहा जाता है कि ज्ञान बांटने से वो बढ़ता है. So that is what I think that is what is the one philosophy I always believe, and Dr. Rajendra Prasad has done that. He could well have actually, he's as famous as he is. He could have done it without even writing this book or creating this book. He would have still the same Rajendra Prasad, the same respect and the whatever he is, it is there, but he has tried to share and distribute his knowledge amongst his students and the colleagues. So I again thank Professor Rajendra Prasad and congratulate, and I am sure all of us will be benefited by going to or getting his knowledge as he has very kindly, I know he has tried to share with us. So thank you much and all the best for the new book.
Thank you, Dr. Behra. Bhumika, you can call Dr. Suryakan now.
Yeah, thank you. Thank you very much for inviting me on this very important occasion. And as Dr. Behra had mentioned, that Dr. Rajendra Prasad is the teacher of teachers. You just take the name of anyone in Uttar Pradesh and probably directly or indirectly has been a student of Dr. Rajendra Prasad. On chest X-ray, if you see the beauty of chest X-ray, it is the third X-ray performed in India. So whatever number of X-rays performed in our country, the third X-ray is the chest X-ray. So this is the importance and significance of the chest X-ray. And respiratory symptoms are the commonest symptoms in private practice, in general practice. A study has been done where the survey was done that what type of patients coming to you are the commonest symptoms. So this chest X-ray book edited by Dr. Rajendra Prasad, this will be a very important book for not only the residents, the practitioners also. And I wish that this book should be in the every medical, so that they can just have a first-hand reference from this book and they can update the knowledge and chest fraternity. Thank you very much for this opportunity.
Yeah, welcome Dr. Ashok sir. Welcome. Yeah. He's a senior consultant at Pulmonary and Critical Care Medicine, Regency Hospital, Kanpur Secretary, and UP Chapter of Indian Society. Welcome, sir, on the Medisage platform.
So, first of all, I would like to congratulate to my dear sir, Dr. Prasad, who is my teacher, and saying thank you for compiling this book, because I know that a lot of effort is needed to just write a single case report. I can understand how much effort you have taken for compiling this book. Second thing that Dr. Suryakan says, that is the most common investigation in clinical practice. So it is not important for the pulmonologist, even you are the general physician, whatever the specialty you practice, but you should know the chest X-ray. Because this investigation is the simplest investigation and most difficult investigation. Sometimes you read X-ray for 40 years, and a single X-ray can make your thought block. So there is no limit for learning the simple chest X-ray. I think Dr. Prasad has included everything in this book. So I will recommend all the students, whether it is MBBS or the postgraduates, whether it is medicine or pulmonary medicine, they should go through this. One thing more, I want to say that because we have learned everything from Dr. Prasad during our training. I know that whatever the clinics was there, especially in the afternoon when we do the case discussion from the OPD. And that is the real training in X-ray and the case. Most of the time we put the X-ray in the board and he asks, "Kya hai batao?" And after telling everything, we miss most of the things at that time. And that is the way how to teach. But I think this is one of the best efforts to teach the youngsters. Thank you again, sir, for doing this much of efforts. I think this book will be very, very helpful for all clinicians, for all specialty.
Yeah. I would like to introduce Dr. Kiran Vishnu, sir, who is the Associate Professor, Department of Pulmonary Medicine at GMC, a double gold medalist from KGMC, Lucknow. He strives to excel in his brilliant academic background and has been awarded as Young Promising Pulmonologist of Kerala by the Academy of Pulmonary and Critical Care Medicine. Welcome, sir. Welcome, Dr. Kiran, sir.
Thank you, Bhumika. Thank you, Prasad, sir.
I think Bhumika, you can unshare his slide so that better pictures might be. Yes, that's okay. Yes, go ahead, Kiran.
Thank you, sir. Thank you for the opportunity, because I'm deeply indebted and extremely grateful to Prasad, sir, for because as we all say, he's not a mediocre teacher, because we have been taught by actually Prasad sir himself that the mediocre teacher tells, the good teacher explains, the superior teacher demonstrates, the great teacher inspires, but an excellent teacher like Prasad sir nurtures talent also. He's actually a person who imbibes all these characters and also nurtures talent, in that he strives to bring up talent and also makes us part of his greatest offerings to people and students. And I'm extremely indebted, because sir has been so gracious in putting my name also in this, as Behra sir was saying. The entire work, I would say 99.9% of the work has been done by Prasad sir, and we have just been images on his book, and I bowed down before Prasad sir for giving me this opportunity. And to the listeners, I would say that this book is actually a picture sequel to 40 years of hard work, dedication, perseverance, expertise, and toil of a teacher, a gentleman named Professor R. Prasad, who has etched his entire experience into just 500 pages for easy reference. So it's actually a 40 years of journey of meticulously capturing those images and those x-rays, and then tagging them into files, and then reverting back and utilizing those files and x-rays for the use of people like us. And as AK Singh sir was saying, I still recall the number of times we used to rehearse cases and x-rays before presenting. So Professor R. Prasad would sit in his room, and we would bring the cases, difficult cases for presentation. And I still I get reminded of the number of times we used to keep on rehearse the history, and then we would use to check the x-rays for so-called thorough examination of chest x-rays, and then we would give it to sir, and sir would say, "Arey bhai, you have missed 5 findings," and we would actually fumble, and then sir would be so kind enough to teach us those findings. And then as time passed, we changed from the systematic approach to the generalistic approach, as sir mentions in his book. So as expertise and experience improved over these years, we have now moved to a generalistic approach from the systematic approach Professor R. Prasad has taught us all. And I still feel that most of R. Prasad sir's students are a notch up higher in interpreting chest x-rays. We have friends in South, starting from North to South, and we know when we discuss among our friends and our classmates that Prasad sir's teaching has helped us a lot in general practice also, because in a location or an area where CTs are not available, we would actually make most of the findings that are most evident on X-ray using the approach that Professor R. Prasad has taught us. And even in the era of artificial intelligence, an artificial intelligence computer can only grasp images that have been taught by a good clinician or a good radiologist. Because if you give them 2000 images of a particular finding, the AI computer is going to take up the prototype only if it has been taught properly. So I think this book will be helpful for a lot of MBBS graduates to seasoned clinicians in honing up their skills and getting an idea of those picturesque images of each condition, so that these images will actually act as a memory boost when they see a new X-ray. And I hope that this X-ray book would be useful and be guiding a lot more of generations as India's Felsen. Thank you, sir. Thank you so much.
So thank you. And I would just like to say in short, as a physician's perspective, so I think I am the only one who is MD medicine here. And so as a physician's perspective, this book, so it starts right from the basic. We have, right from the MBBS days, we had started reading the X-ray book. So first thing is that probably from the clinician's point of view, this book is from the clinician's point of view rather than a radiologist's point of view. And as a physician, as a general practitioner, I think this book is going to be very, very helpful. As most importantly, the basics needs to be revised every time. And so that part will start from the basic and as a systemic teaching. So that is the part which I think I most have liked in this book. And and then covering all the respiratory diseases up till and so that is going to benefit right from the MBA students to the PGs, private practitioners, and DM and all, and in fact all other specialty also, because they will also be requiring to read a section.
Sir, we had a panel discussion also.
So panel, I think we did it. Dr. Behra, do you need extra thing to say?
Yes, sir. I am here listening, sir.
So I think we have whatever we have to say. We said this was the. I mean, it covers most of the thing, and it was just initial an opening of rather e-opening. And this book also has a e-book. This book, this beauty of this book is it is in hard copy and it is also in the e-book form, because I thought that the X-rays will be better visible in the e-book form. So it is also available in e-book form. Before I will hand over mic to Bhumika, just I wanted to say that as I have experienced in about more than 45 years, many of you, and I'm lucky that I have been teacher of most of you, that we see in our day-to-day clinical practice lot of issues in chest X-ray reading. A lot of sometimes diagnosis is missed. Sometimes it is over-diagnosis. That disease is not there, but somebody is diagnosed by the X-ray, and then the wrong diagnosis. So everything I have seen in my 45 years of it. And what I try to put in this book, that try to read I used to say that for first 15 years one should read systematic. So I put the book in very systemic way of reading. And idea is that make people aware how to approach a chest X-ray. Whenever I teach chest X-ray, I say that when we see chest X-ray, our aim is to first, there are two questions in my mind. One question is always whether X-ray is normal or abnormal. And the second point is if it is abnormal, to say it normal also is a very difficult issue. And whether it is, if there is abnormal, then what is the possible abnormality? Although chest X-ray cannot tell everything, but at least you can have idea. So that is with this aim this book was written. And to say X-ray is normal again is a very, very important issue and $100 question. I always say many of the misdiagnoses I have seen, there is no disease, somebody has diagnosed a disease. I think with this much, what I can say, probably book, I tried my best to keep book in such a way that it is interesting and people should go through it. And only my idea was to have a better clinical medicine whenever, because in X-ray is one of the common investigations, as Dr. Behra said. With these few words, I must thank from my side to Dr. Behra who joined, because he wrote the foreword. He was one of the foreword writer, and I have a very esteemed regards from him. We are working together for last maybe 30 years. And then I would like to thank Dr. Suryakant, who is professor and head respiratory medicine, who has also been one of the very pet students. And then AK Singh and Kiran Vishnu has been, they did MD under me, and they have been our very, very, I can remember some of the good students. So I always take name of, and that this is the, AK Singh was one I always remember. He was the one who started to work on ABPA. Then we could 4 thesis. That's why I put one radiological findings of ABPA. And then I must thank Dr. Nikhil also, who has helped me a lot in bringing out this book. And then Medisay is really for having this opportunity to e-release of book. I think this is the first time any of the book has had an e-release. So with this, thank you all, and I hand over mic to Bhumika to close it.
Thank you so much, Dr. Rajendra Prasad, sir. It was a very, very interactive discussion on chest X-ray radiology, and of course, as you said, the e-release of your book. I think all the live delegates who have been present with us today, which we have around 400 plus live delegates present with us, are very excited for this book launch, and I'm sure it is going to help the entire healthcare community, the PG community as well. Sir, one question has just come up from the live audience. If you could address it, has been, how has the rise of telemedicine impacted the interpretation and reporting of chest radiology studies? If you could throw some light on this question, sir.
Okay, telemedicine, is coming up. Now, you must have heard about tele-reporting. X-ray is done at one place and it goes to the expert radiologist. So they read it and they immediately transfer the report. So telemedicine in that way has been very useful, because at every place there are not good reader of the chest X-ray. I'll go a step ahead. For telemedicine now, as somebody touched, that artificial intelligence are coming a lot in reading the chest. Actually, the artificial intelligence can initially screen that what is the possible disease, and then clinician can decide that which disease he is suffering from. So these things are coming up very fast. And telemedicine has really helped us in reporting at a very distant places and very far off places. So that is all about telemedicine.
Thank you so much, sir, and well said. I think artificial intelligence and telemedicine are definitely playing a role. The delegates are very, very interested for this book launch, and I'm sure it is going to help each one of them. Thank you so much to all the faculties and the panel who has been present today and has shed some light on this topic with their immense experience and thrown some insights. Thank you so much.
Thank you all.